Every morning, millions of Americans wake up and reach for water before they even open their eyes. Not because they're thirsty. Because their mouth has completely stopped working overnight. No moisture. Tongue stuck to the roof of the mouth, throat sealed shut. Can't even swallow. Most people blame age. Their doctor blames age. So it gets ignored for months. Sometimes years. But here is what the research actually shows. A 2022 study in the Journal of the American Geriatrics Society found that chronic dry mouth overlaps with the four most dangerous health crises in adults over 60 at a rate of 61%. Aspiration pneumonia. Systemic infection. Progressive malnutrition. Medication toxicity. That's not a side effect. That's a warning system going off. And by the end of this video, I'm going to walk you through 7 specific signals your dry mouth is sending right now. Signals that most physicians never catch. One of them, signal number 4, is the one I've seen lead to the most preventable hospitalizations in my entire career. So stay with me on this. I'm Dr. Robert Anderson. I've spent more than 2 decades in internal medicine and senior health. And I have reviewed thousands of patient cases where one overlooked morning symptom turned out to be the early sign of something serious developing underneath. Dry mouth is that symptom. And I want to be clear about what we're actually talking about here. This is not waking up slightly parched. This is a condition called Xerostomia. It's a measurable collapse in salivary gland function that quietly changes what's happening inside your body every single night while you sleep. Let's start with something most people don't know. Saliva is not just for chewing food. It is one of the most complex fluids your body makes. It contains over 700 proteins, enzymes, and antimicrobial compounds. It is your mouth's immune system, your digestive ignition switch, and your throat's first line of protection. Here's what happens while you sleep. Bacteria from your mouth get microscopically inhaled into your lungs. Every night. This is normal. It happens to everyone. But in a healthy mouth, saliva neutralizes those bacteria before they travel anywhere. It contains compounds called immunoglobulins and lysozyme. Think of them as your mouth's security checkpoint. When that checkpoint is gone, those bacteria reach your lungs. Night after night after night. A 2021 study from UCSF followed over 12,000 older adults and found that those with confirmed dry mouth were nearly 3 times more likely to be hospitalized for respiratory infection within 2 years. 3 times the risk. From something most people don't even mention to their doctor. Now here's where it gets more complicated. Over 500 commonly prescribed medications in the United States list dry mouth as a side effect. Blood pressure pills. Antidepressants. Antihistamines. Bladder control drugs. Sleep aids. Diuretics. When a senior takes 3 or more of these at the same time, the effect does not add up. It multiplies. Research from the Journal of the American Dental Association in 2023 found that 3 of these medications combined can cause 6 to 8 times the salivary suppression of just one alone. This is called compounding xerogenic effect. And almost no doctor brings it up during a standard appointment. The medications responsible belong to a drug class called anticholinergics. They are among the most aggressive suppressors of saliva production in modern medicine. If you are on 3 or more medications right now, hold that number in your mind. It matters more than you think. We are about halfway through, and I haven't gotten to the most serious part yet. Because dry mouth doesn't stop at your lungs. It reaches your heart, your brain, your blood. Your mouth is home to around 700 species of bacteria living in a carefully balanced ecosystem. Saliva keeps that balance in check. When saliva disappears, the dangerous species surge within weeks. And according to research published in Nature Reviews Microbiology, they don't stay in your mouth. They enter the bloodstream through tiny breaks in your gum tissue and have been directly connected to heart valve infections, cognitive decline, worsening diabetes and sepsis in older adults. This was never just a mouth problem. Now let's go through the 7 signals. Pay close attention here because this is the section most doctors skip entirely. Signal 1. Ammonia or metallic smelling morning breath. If your breath smells chemical rather than just stale, that is a potential kidney function warning. Ask your doctor for a kidney function panel. Signal 2. Thick, ropey, or foamy saliva in the morning. This is not an absence of saliva, it is altered saliva, and it points toward an autoimmune process like Sjogren's syndrome, lupus, or rheumatoid arthritis. Ask for autoimmune screening. Signal 3. Dry mouth only at night but fine during the day. This is a direct sleep apnea pattern. Your airway is partially collapsing during sleep and forcing mouth breathing for hours without you knowing. Ask your doctor about a sleep study. Signal 4. Dry mouth combined with frequent nighttime urination. This pairing is a diabetes warning sign. High blood sugar pulls water from every tissue in your body, including your salivary glands, while simultaneously driving up how often you need to urinate. Ask for a fasting glucose test and an HbA1c. Do not wait on this one. Signal 5. Dry mouth combined with dry, gritty, or irritated eyes. This is a hallmark sign of Sjogren's syndrome. It affects an estimated 1 in 70 women over 60 and is dramatically underdiagnosed. Left untreated, it can progress to the kidneys, lungs, and nervous system. It is treatable but only if it gets caught. Signal 6. Dry mouth combined with leg cramps or foot cramps. This combination points to a serious electrolyte imbalance. Low sodium, potassium, or magnesium. It is especially dangerous for anyone already on a diuretic. This specific pairing can trigger cardiac arrhythmia. Call your doctor this week, not next month. Signal 7. Dry mouth that started within 90 days of a new prescription. The 90-day window is when anticholinergic suppression reaches its clinical threshold. Your body is telling you it needs a formal medication review. Ask for one by name. Now let's talk about what you can actually do. Most people try to fix this by drinking more water. That's the wrong approach, and here's why. Salivary glands need electrolytes to function. Sodium, potassium, bicarbonate. Plain water dilutes those further. Drinking a large glass at bedtime doesn't restore gland function. It just sits there. Small sips throughout the day combined with electrolyte-rich foods is far more effective. Step 1. Every morning before you drink anything, spend 60 seconds doing a mouth check. Is saliva present? Is it thin or thick? Is there a chemical smell? Can you swallow without needing water first? Do this daily. That information is exactly what your doctor needs. And almost never gets. Step 2. Write down every medication you take. Prescription and over-the-counter. Look up each one for the words anticholinergic or xerogenic, then tell your doctor this exact sentence. I would like a formal polypharmacy review focused on my combined anticholinergic burden. Those specific words change the conversation entirely. Step 3. At night, elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows. Run a cool mist humidifier set between 40 and 60% humidity. Use a xylitol-based dry mouth rinse before sleep. Never use an alcohol-based rinse at night. Alcohol accelerates tissue drying and makes the problem worse. Step 4. After meals, use xylitol gum. Sour sugar-free candy activates the parotid glands directly. Crunchy raw vegetables with meals support natural saliva flow. These are clinically supported and cost almost nothing. Step 5. When you talk to your doctor, use this language exactly. I have been experiencing chronic xerostomia that is affecting my sleep, my nutrition, and my ability to swallow comfortably. I would like to discuss whether my medications are a contributing factor, and I would like to request a salivary gland function assessment. Clinical language produces clinical results. And then know these red flags that require immediate action. Dry mouth with difficulty breathing, go to the emergency room now. White patches appearing inside your mouth, call your doctor today. That is oral candidiasis and it spreads fast. Dry mouth with sudden confusion or muscle weakness. Call 911. Dry mouth with chest pain or a racing heartbeat. Call 911. Dry mouth with an unexplained fever, go to urgent care the same day. Here is what I want you to take away from this. If a doctor told you it's just aging, that is not a diagnosis. That is a dismissal. Clinically significant xerostomia is almost always caused by a medication, an underlying condition, or both. You now have the vocabulary to push past that answer and ask the right questions. And one more thing before you go. Dry mouth doesn't live by itself. The same inflammatory processes that damage your salivary glands are often running in parallel with changes in your cardiovascular system, your metabolic health, and your cognitive function at the same time. What starts as a dry mouth in the morning can be the first visible sign of something your body has been fighting quietly for years. That is why I want you to watch the next video on this channel about nighttime inflammation and cardiovascular risk. Because the connection between what happens in your mouth while you sleep and what happens to your heart is one of the most underreported stories in senior medicine today. Your body is sending you a message every morning. The only question is whether you're listening.